I'm your host, Amberlyn Carroll. Thank you for joining us on Medwatch today. The Heart and Lung Institute is Community Health System's system-wide approach to cardiac care, giving patients access to services they need closer to home. So when local restaurant owner Sam Toledo needed a higher level of heart care, he says the team at Community not only helped save his life, but inspired him to cook up a healthier future.
I started working in the restaurant industry when I was 15 and a half, around there. So then I started washing dishes.
Known for his successful Toledo's Mexican food restaurant in the Valley, owner Sam Toledo says when he started noticing changes in his health, he was concerned.
No strength, I feel really tired. Sometimes I feel like short of breath. But all those symptoms, I thought it was because my diabetes.
Sam began his journey as a patient with Kaiser, but because of his complex condition and the level of care he needed, Sam was referred to Clovis Community, one of the hospitals that is part of the Heart and Lung Institute.
Our cardiologists have worked very hard to develop our Heart and Lung Institute at Clovis, and now we're servicing Kaiser as whenever it's needed. And it turns out our Kaiser patient experiences have been wonderful. Dr.
Shamsuddin Khwaja is the medical director with the Heart and Lung Institute and was Sam's cardiothoracic surgeon.
Sam developed a aortic valve stenosis, and then on top of that had blocked arteries. So we had to do valve replacement and do bypass surgery.
Normally when these big surgeries happens, they send you to San Francisco or they send you to LA. And I was very surprised that they have the community hospital in Clovis that is available for these kind of surgeries. Feel like I'm at home, I'm close to my family.
The Heart and Lung Institute not only increases access to heart care in the Valley so patients don't have to travel far, but also increases access to advanced cardiac resources as well.
We get these patients because some hospitals in our area just don't have the ability to take care of very sick patients, have the state-of-the-art technology that we have within the Heart and Lung Institute.
Dr. Khwaja says the next part of Sam's journey isn't to completely change his lifestyle, but make changes for a healthier future.
I think part of what Mr. Toledo is trying to do is change his diet, of course, for good, but not to cut out what's culturally important to him, what's culturally important to his family, and what's important to his taste.
Sam says he plans to be more active, create healthier recipes with his granddaughter, and manage his stress levels by slowly stepping away from the day-to-day business and handing over his restaurant legacy to the next generation.
I haven't enjoyed life at all. Just working. But I got my kids that they're gonna take over. They're gonna start working. They're already working with me.